Hello, welcome to Inova Fairfax. Team Nova is in the emergency room after being called to do a preoperative assessment on a 24-year-old male who was just brought in by ambulance after a bicycle accident. The patient is reported to have visible face trauma and is scheduled for an orbital fracture repair. The fracture was found on CAT scan. His head CAT scan was negative for any bleeding. Our patient, Thomas Donnelly, has no known drug allergies and no significant past medical history. He had a tonsillectomy in 1990 and a laparoscopic appendectomy in 2005. No anesthesia complications were reported by the patient. He takes a chewable Flintstones vitamin, preferably the gummy kind, and an omega-3 fish oil supplement daily. We will be performing an in-depth neurological assessment on Mr. Donnelly. The neurological assessment will help us determine whether he has any central or peripheral nervous system dysfunction. We will assess the motor system and sensory system. We will also test his muscle reflexes and mental status. A Glasgow Coma Scale assessment will be performed. We will be concerned for possible signs of increasing intracranial pressure or cerebral ischemia, as well as possible nerve injuries.
I'm going to do your airway exam now. Can you open your mouth for me? Stick out your tongue. Oh, please don't phonate. Good. You can stick your tongue back in your mouth and show me your teeth, please. Are they all your own teeth?
I have dentures on my upper half.
Oh, could we remove those, please?
Sure.
Here, I'm the nurse.
Thanks.
Sorry.
Okay, so your lowers, are they all your own?
Yes.
Anything missing, chipped, loose, crowns, anything?
No.
All right, very good. Do you have full range of motion of your neck? Can you move side to side, up and down? Good. Does that hurt you?
Mm-mm.
Good. And tilt your head all the way back.
Mental distance greater than 7 centimeters, a decreased mouth opening of less than 2 finger breadths, upper dentures that were removed, no chipped, cracked, or loose lower teeth. He had a Mallampati classification of 2, and he had full neck range of motion with no pain.
Emily,
Do you know where you are?
I believe I'm in Abingdon, Virginia.
Are you sure about that?
Ooh, no, I would never want to go there. I'm in Alexandria, I hope.
Yes, Alexandra Hospital. Good job.
Okay.
Do you know what time it is or date?
It's the morning of some day in February, but I don't.
Yes, good job. It's February 26th today.
February 26th.
Do you know what year?
2015.
Yes, good job. Okay. Do you know what happened to you? Do you know why you're here?
I think I fell off my bike, but things have been a little hazy.
Okay. Yes, that's what happened here.
Mr. Donnelly was following commands, his eyes opened spontaneously, and he was alert and oriented to person. He's been intermittently confused to his location, situation, and the time.
Okay. Can you shut your eyes and plug one side of your nose? Sniff. What do you smell?
Alcohol.
Good. Do the other side of your nose. Sniff. What do you smell?
Alcohol.
Good job.
Thank you.
I'm going to shine a bright light in your eye, okay? Shut your eyes.
Cranial nerve 3,
Open.
the oculomotor nerve, controls pupillary size and the response to light.
Shut your eye. Open. Okay. Pupils are equal, reactive, round, about 3 millimeters.
Preoperative pupil size should be recorded to provide baseline data for subsequent assessment of anesthetic depth, narcotic effect, and for comparison with postoperative pupil changes. Cranial nerve 5, the trigeminal nerve, is tested. The motor side is tested by examining bilateral strength of temporal and masseter muscles while the patient clenches his or her teeth. The sensory portion is assessed with the patient's eyes closed. We test the forehead, cheeks, and jaw for light touch and temperature with an alcohol wipe. Cranial nerve 7, the facial nerve, innervates muscles for facial expression, mobility, and symmetry, and provides sensory innervation for taste sensation. It is tested by evaluating the patient's ability to raise eyebrows, frown and smile, close eyes tight, and puff cheeks.
Raise your eyebrows. Good. Smile. Puff your cheeks.
The facial nerve may be damaged by face mask pressure, surgery, or positioning. A baseline evaluation and documentation of any abnormality is appropriate prior to anesthesia induction. Cranial nerve 9, the glossopharyngeal nerve, supplies sensory fibers to the mucosa of the pharynx and soft palate. It is tested with the palatal reflex. We stroke each side of the mucous membrane of the uvula. The side touch should raise if the nerve is intact. The pharyngeal gag reflex is tested by touching the posterior pharynx with a tongue depressor to elicit a gag. Glossopharyngeal dysfunction can cause severe pain and is similar to trigeminal neuralgia. The trigger zone lies in the posterior pharynx and tonsillar area. Stimulation of this area with an oral airway or laryngoscope can result in severe pain locally that spreads towards the angle of the jaw and ear. Patients with cranial nerve 9 disorders can experience reflex bradycardia and hypotension during pain episodes, secondary to intense afferent discharge of the glossopharyngeal nerve. It demonstrates ataxia, especially with the eyelids opened. We'll now assess the motor system. We assess muscle strength, tone, and size, and it should be evaluated for asymmetry.
Mr. Donnelly, can you please squeeze my hands? Good job. Now, can you lift this leg? Try to push against me. Good job. Now the other one. Good job.
Evaluation of the peripheral sensory system is important before any regional anesthetic technique. Upper or lower extremity dysfunction, motor or sensory, may suggest that a regional anesthesia technique is undesirable. Ask the patient for any deficits in sensation.
Are you feeling any numbness or tingling in your body?
I am not.
Do you feel like the loss of, say, sensations in any of your extremities or your body?
No.
Reflex testing has 3 types. They're categorized as deep, superficial, and pathological. The site of the reflex stimulus and response corresponds to a specific central nervous system segment. The deep tendon reflexes include the biceps, which is cervical level 5 and 6, the patellar, lumbar level 2, 3, and 4, and the Achilles, sacral level 1 and 2. They're easily tested.
No.
Have you ever had a seizure?
No.
Any tremors?
No.
Weakness?
No.
Problems with coordination?
No.
Can you throw a football?
Well, not correctly.
Any numbness or tingling anywhere?
No.
Any difficulty speaking? I have that one.
No.
Difficulty swallowing?
No.
Do you work in an area that exposes you to hazards? Occupational hazards? Environmental hazards?
Can you define hazards?
Nitrous oxide?
Yes.
Inhalational agents?
Mr. Donnelly's surgery went well with no complications. He's now resting comfortably in our inpatient unit. Please see our PowerPoint for any additional details.